Rights in You, the show that focuses on federal, state, and local civil rights issues and the role they play in your daily life. My name is Charles Bryson, your Director of Civil Rights Enforcement Agency, on the auspices of Mayor Lyda Crewson, and your host as always. Today, our theme song is After Hours from Ronnie Jordan. The podcast can be seen on Facebook Live and recorded at mymusicmycity.com. Thank you for joining us. Today, in the whole entire month of May, we're going to be doing podcasts focusing on various aspects of mental health, trauma, stress, toxic shock, and grief. Today, and if I get anything wrong, please jump in. Nancy Cambria, who is the former reporter of the Post-Dispatch and currently the Director of Community Relations, Media, and Development at the University City School District.
Yes, hi, Charles.
Good. Dr. Cynthia Rogers, child psychiatrist and associate professor of pediatrics at Washington University.
Yes, associate professor of psychiatry and pediatrics.
Okay. Thank you for adding that.
Of course. Good morning.
And Risa Rawlings Easley, who is the assistant teaching professor and project coordinator with the School of Social Work at University of Missouri St. Louis, also known as UMSL, correct?
Good morning, yes.
Good. I'm glad I got that out of the way. Okay. So anyway, Nancy, let's start with you. So the impetus of this whole group of podcasts for the entire month of May is based on your article from, I guess, several years ago, The Crisis Within, How Toxic Stress and Trauma Endanger Our Children. So what was the impetus for you jumping into what obviously was a very difficult subject?
Sure, Charles. Well, I had been covering children and families for about 12 years at the Post-Dispatch. And early on in the beat, I really decided that this was a beat that really wanted to cover families and children that were falling through the safety net and the cracks. These are people who don't have a lot of advocates, and the systems sometimes don't work. But it quickly became apparent to me in doing this beat at the Post-Dispatch that so many of the children I was covering and families were dealing with trauma. And particularly families in poverty were dealing with trauma. So when Ferguson occurred and the newsroom was just all hands on deck out covering the events there, I noticed a lot of children on in the protests themselves. And to the parents' credit, they were there because they wanted to see their children be part of this movement. But at the same time, from a child development standpoint, the kids were processing this in a very different way than adults would, so it was in itself a bit traumatic. And then I went to a Red Cross drop-in center in Delwood, and the shell shock look on many of the residents' faces was just really stunning. And this was about 3 days after things had really started to get very intense in their neighborhood. And then I went inside and talked to some counselors and therapists who had been brought in to help. And they said, you have to understand, many of the people here aren't just reeling from what's happening in their neighborhood now. They're not experiencing trauma. Now, they're also re-experiencing many sad things that have happened in their lives before. They have PTSD, and this has triggered it tremendously. So that really it stuck with me for about a year. I had decided I wanted to do something more on toxic stress and trauma. I was learning a lot about it. I got a fellowship, and we decided that we would work in Ferguson to talk about how this had affected children. And right as we started our reporting on this is photographer Lori Scrivan and I, a little girl named Jamila Bolden was shot and killed while doing her homework in her mom's bedroom. And Lori and I happened to be in the neighborhood when this came over the scanners, and we went over to the house, and I have never seen a sadder scene in my life, and I've seen a lot of sad things. And Lori and I decided there that we were going to find some children who knew her and some of her friends and follow them. And the idea was not to just follow the trauma of this violence itself, which was intense, but also their lives. So we spent 7 months with these children, and their parents and grandparents were incredibly kind and brave to let us follow them. And what we saw was a cycle of stress and trauma over and over and over in homes that had poverty, instability. So that's how the story came out. And so all the things I learned about toxic stress and poverty that over the years played out over those 7 months with many of those families that were facing homelessness, families that were facing eviction, families that were facing unemployment, and of course the trauma of what had already happened to their children. We had a mom who was very concerned her kids were going to end up in foster care because they couldn't stay in their house because the power had been taken off. So these things really added up over time.
So I want to be clear, because
Yeah.
I would use the term stress until I read your article.
Right.
And these are not just, because having a background in homeless services for many years,
Right.
both in St. Louis and Baltimore and Springfield, Illinois, we talked about stressors way back when. But now there's a new term with substantially, I would argue, much more definition in terms of the daily life that people lead. Would that be fair?
That's true. And really what it is that, when a family is in crisis all the time, the stress level in that household increases. And if there's not a lot of supportive factors for children in the household because mom and dad are so stressed out, that these actually have real consequences, both in brain development and physical development. And that can set a child up, and also adults up, for a series of health consequences all the way into adulthood, which I think there's others at the table here who can talk about that a little bit more. But so in my mind, particularly the brain development aspect of what happens when a child does not get the support he or she needs because of this stress in the household, causes the brain to develop differently. And the brain is a noble creature. It develops to survive, and it develops when a child is so stressed to really handle stress. But the issue is that stress and the way the brain develops kind of it puts you in a fight or flight response. You know how you feel, especially like when you almost get in a car accident, that jolt that runs through your body? Well, think of that as constant, and what happens is your heart rate goes up, your blood pressure goes up, and all of that over time puts stress on the body. And particularly in the brain, if a child has a developing brain, the brain is developing in ways that more handle stress. And when that happens, when you're stressed or you've had a death in the family, it's very difficult to make very good decisions because your body is in a stress mode. Well, think about a child who has that and then has to go to school and learn. And the brain has equipped this child to handle this stress, but the brain has not equipped the child to really deal with the social situations in school because the child is so hyped up on stress. That's a very simplistic explanation of it, but in my mind, this turned everything on its head. All of this talk about pulling oneself up by the bootstraps, or children are not doing well in school because they don't have personal responsibility. Well, if you've had this kind of stress impact your brain and body that way, you're not going to be able to learn. And you will have, I would say the brain is very resilient. Children have capacity to do that, but without supports, it's going to make that much harder.
Dr. Rogers, let's talk about some definitions here so folks are clear. What is trauma, and what is toxic stress?
So trauma is a word that's used in lots of different contexts. So just to clarify, some people use it as physical trauma. And so in medicine, that's something that we always have to clarify. But in this context, we're really talking about psychosocial trauma, which is really just stress that is so severe that it overwhelms our capacity to cope. So we don't have the coping skills to deal with it. And stress is really a phrase that is a little bit, used ubiquitously, but there are positive stressors that we have, and our body is really well equipped to handle those. We have systems in our bodies, a long-term stress system, a more, as Nancy put it, fight or flight system that's more immediate, that can handle positive stressors or stress that we should be able to cope with. Going to the doctor to get a shot for a child, for instance, is stressful, but our body's equipped to handle that. Then there's some longer-term stressors that can be, more intense, but still our bodies are able to be equipped to handle those, like a death in the family or a natural disaster, those sorts of things. Often if they're limited and you have the support of family to help you get through those, we're well equipped as human beings to handle that. Toxic stress are really stressors that are prolonged, severe, and occur in the context usually without that sort of supportive caregivers to help the child. So when we think about toxic stress, we often think about things like child abuse, whether it be physical abuse, sexual abuse, or neglect, exposure to parental substance use, parental mental health that's untreated, mental health disorders that are untreated, and all of the stressors that can go along with extreme poverty and exposure to chronic violence. And so the differentiation isn't just the severity and the frequency, but really whether or not there is an environment, a supportive environment to help the child get through it. Because some children can be resilient to those exposures, but that's usually in the setting of having those supportive caregivers around.
So if I am a young child, and we'll talk about the womb in a minute because I thought that was fascinating. So if I'm a young child and I am I'm trying to get the terms right. If I'm under trauma because of things that are going on in my neighborhood, but my family has that same trauma, then there's no individual person to help me work through my traumatic experience. Would that be fair?
Yeah, if your parents are equally stressed, equally traumatized by the same events, and what we also see a lot is what we call intergenerational transmission of trauma. So parents themselves that experience childhood trauma and then continue to experience traumatic events throughout their adult life, things like intimate partner violence, exposure to crime and violence, then they have the sort of prolonged results of their traumatic exposures. And now they have children for whom a lot of the cycle of exposure is also continuing. So they don't have the ability to not only cope with their own trauma, but also to help their children get through the traumatic exposures that they're facing.
I made a note to myself. When we're talking about the cycle of poverty, may we also be talking about the cycle of toxic stress?
Often the things that are that we think about that cause toxic stress are highly correlated with poverty. That doesn't mean that everyone in poverty is experiencing all those traumatic exposures, but we do know that rates of abuse, neglect, exposure to violence, all of those things are highly correlated with poverty. And so, yes, if there's a continuing cycle of family members being in those environments where those exposures are occurring, then the cycle of poverty is, yes, very, very highly correlated with the cycle of trauma.
What is the Adverse Childhood Experiences, or ACE study, and what is it designed to do?
So this was a study that was carried out in the mid-90s in California. It was a combined study from Kaiser, Permanente, and the Centers for Disease Control. And so Kaiser was trying to figure out why so many of their patients were not getting better, basically. And so they decided to examine, I think it was over 17,000 of their members participated in the survey. And among the things they asked in the survey, they asked about childhood experiences like physical abuse, sexual abuse, emotional abuse, neglect, parental separation, exposure to parental mental health, and substance use. And so what they did with that data is they then looked at the respondents that reported that they had those exposures and then looked at their long-term health outcomes and found that exposure to what they called ACEs, adverse childhood events, was related to rates of chronic disease, cancer, diabetes, high blood pressure, and then mental health outcomes, alcoholism, depression, and others, and found over years that there's a dose-response relationship, meaning that the more ACEs a person experienced during childhood, the worse their health outcomes were as adults. And actually, that study was one of the reasons why I ended up going to child psychiatry, because I was at a conference in the late 90s, traumatic stress conference, where they were presenting this data. And that was one of the reasons why I thought, oh my goodness, we need to work with children to reduce these exposures and mitigate these exposures if we want to actually make a public health dent in a lot of our major illnesses.
Now, when you talk about adverse reactions, you're talking about both physical and mental, emotional. You're not just talking about, they're having difficulty in life. This also affects you physically as well.
Yeah, so one of the things I think it's important for us to all realize is it's difficult to disentangle what emotional and physical, because emotional is just sort of the output of the brain, and the brain is connected to the rest of the body. And so the same stress system that was increasing people's risk of cardiovascular disease, affecting their immune system, so they were at higher rates of infection and of cancer, and affecting their ability to engage in positive health behaviors is the same thing that leads you to have depression and the same thing that leads you to have post-traumatic stress disorder. And so if you have an exposure that affects your nervous system and affects your brain, it's likely going to affect the rest of your body. And we now recognize that alterations to the brain, alterations to the immune system, really impacts our entire bodies. And that's why the health outcomes were so pervasive. It wasn't just mental health, it wasn't just cardiovascular health, it wasn't just immune health, it really was everything.
So let's talk a little about the womb, which I thought was just an amazing part of the story, and how toxic stress can be passed on from the mother to the child.
Mm-hmm. So we do a lot of research on this at Washington University in the lab that I co-lead, trying to understand why things like poverty, maternal mental health, maternal substance use is altering the child's brain at birth and also affecting their later outcomes. And what the research has shown, both looking at humans and looking at animals, is that a mom who is stressed, when her stress system is activated in ways that is chronically out of whack, to not use a medical term, it's really affecting it. That those hormones can cross the placenta and affect the brain. It's affecting mom's markers in her blood that have to do with her immune system that relate to inflammation, and those can cross the placenta and affect the developing brain of the child. And so that exposure to that stress in the womb can cause the baby to develop abnormally. It also affects her pregnancy. Yes. It affects her pregnancy health behaviors. If you're super stressed and depressed, you're not attending your prenatal appointments because it's hard for you to do anything to take care of yourself, and that affects whether or not you have a healthy pregnancy. There's also likely what we call epigenetic effects, so where it's changing the way that our genes are expressed because of being exposed to stressors while in the womb. And some of those actually get passed on from mom to child. So if her expression of her genes got changed from her traumatic exposures, then those changed genes are getting passed on to the infant. So it looks like it's happening in lots of different ways, and just highlights why it's so important, if we want to prevent these outcomes in children, that we have to start often even before the child's born.
Cynthia, and Nancy, I know you in your, and I'm not going to try and thumb through here, but there was something about the wiring of the brain that may have an effect later on.
Sure. First off, I just want to go back to Cynthia because two things about early childhood and womb development. That one is sitting really hard with me today is that I have a friend who I met through reporting who has been through poverty and the ringer, was homeless in high school, managed to, really just succeed. She went on to Jefferson City and to Lincoln University and held so many jobs. And was expecting her first child and did have her first child, but very early. So she is dealing with a 2-pound baby right now who is doing well. But I couldn't stop but think about the cycle of stress and how this actually increases her stress, how this has stressed the baby, and preterm labor is so important. So I just wanted to put that out there. And in my reporting as well, when I talk to moms, but particularly doulas who work with African American moms in poor neighborhoods in St. Louis, I said, so, maternal depression, it's out there, people must have a tinge of it. And the response was, no. They have massive maternal depression. They just don't know it. And this, too, is really implicated in toxic stress. So I just wanted to visit that as a reporter's eye, what I've seen over the years with that. And it's very sobering.
Can I jump in on that? Just so one of the things that we also do is I run a perinatal behavioral health service at Washington University. And so I just wanted to add on to the point that Nancy's making about the impact that these stressors have on increased rates of depression and other mental health disorders during pregnancy, and why those themselves, we really need to think about those as an exposure for the baby too, and why it's so important to do everything we can to raise awareness about perinatal mental health disorders and to try and help these moms get into treatment. And these moms will not present on their own. They often don't even understand what's happening to them, as Nancy was saying. So it's really important that we raise awareness that this is very common, and is more common among women who are in poverty. And so that we do everything that we can to provide the supports that those women need as we're trying to address these effects of toxic stress on children.
So, Charles, I'm going to go back to the brain development aspect of it. And I've done a couple of presentations on this, and I like to talk about it in terms of two things. Babies are born with brain hardware. Not enough of it yet. It develops over time. But it's just the hardware. The software is really what we give to them, what human contact gives to them. So really the best software to make a brain grow beautifully neurologically is love and empathy and support. So from day one, eye contact, being able to hold the baby, being able to sing to the baby, talk to the baby, these are critical things that a child's brain needs to grow well, to grow into this. I compare it to a tree, this beautiful crown of a tree where all the neurons are snapping and hitting all the different parts of the brain. But what happens is if a baby doesn't get this, because parents are so stressed, you end up having a tree that maybe is crooked, right? That big crown tree, it gets all the nutrients it needs, it's got sunlight, it's not stressed. But a child who has not getting those things that it needs, that love, that empathy, that emotion, that support because of the stress in the household, it's going to grow differently. It's going to grow to survive, and it's dealing with stress. So think about the crown of that tree. It's going to be very different. It's going to be kind of skewed. And that's what a lot of kids end up with. They get this kind of brain growth that it's hitting on the different parts of the brain that deal with stress. And one of the bigger things that happens is that in brain development, some of the matter in the brain is smaller in babies who are dealing with stress because it's dealing with that one area of the brain that is really only triggering that stress. So over time, areas of the brain that do executive function, those longer term, bigger functioning aspects, they shrink so that the other parts of the brain that can deal with stress grow. So this wires a child pretty much for life, unless you have that resiliency or those supports.
So can I just jump in?
So
one of the things that we do at our lab is we get MRI scans of babies at birth. And what we know is that while the baby that's born has the brain that is, has all of the parts that it should have, and it is about a quarter the size of an adult brain, there definitely are things that can happen to the brain in utero that can change the way it develops. We're not at a point yet where we can for sure pinpoint all of the areas that are affected, but in addition to potentially seeing changes in the structure of the brain, we also see changes in the function of the brain, and that's one of the things that we and others are spending a lot of time trying to study. There are other parts of the brain, though, that appear, based on research that's been done around the world, to actually be larger, and one of those is the amygdala, which is the part of the brain that we use to process emotions, not just anger, but also anxiety, sadness, all the emotions. And so that looks like a region that may be particularly hit by exposure to stress and trauma. But what we also know is while exposures in utero affect how the brain develops, those first 2 to 3 years of life are really important for brain development. The size of a child's brain at birth is 25% of adult size, but by a year it's 70% of adult size. And by 2 years it's 80%. So that's the most amount of brain growth you're going to see. And it's also at times where neurons and the white matter of the brain, which is really important for information flow, is really developing rapidly. And that's why intervening in these early years is really where we need to be focused and targeting as much as we can. It's not that the brain can't continue to develop, but these are the years where you're going to make the biggest impact.
So I am a pregnant woman, and I go to my doctor and or my clinic or whatever, and the doctor possibly knows something about me, we hope. Is that the point of intervention? Because I don't see it. And so at some point I'm going to get angry, and then you'll have to just relax, because part of me, when I read this, the thing that has always struck me about people who are in the criminal justice field, who are in the education field, sort of miss this point. They miss the subject. It's like you sit in the seat the first day of class, and anything that happened previously is supposedly erased. You are now in my classroom. When the fact of the matter is you bring everything positive and negative to that first day of school, to whatever. And so I think we really do miss this point as a nation around the issues of what causes people to go left or go right or go whichever way. So take me through that. Should it not be at a point in time where you see the doctor first, they ask those series of questions, the nurse, the doctor, whomever, ask those series of questions. Not, how are you feeling? Not, how are you feeling today? No, how are you feeling? What's going on in your life? And then what would be the next step after that?
So we've embedded our services within the obstetric clinics at Barnes-Jewish Hospital, so that the perinatal behavioral health service. So we are screening women, not just with questionnaires, but actually by talking with them to ask them, how are you doing? What are the stressors in your life? Have you been exposed to these sorts of stressors? What are all the supports that you need? It really needs to be multi-pronged, but the obstetricians and the pediatricians, both of their large medical societies have come out and said we have to be screening pregnant women as obstetricians, and even as pediatricians, even though the baby is my patient, we need to also be screening the moms to see how they're doing and making sure that we're connecting them with folks in the community that can help them. So as physicians, it is our responsibility not to wait for women to come to us and tell us what's going on, but just as we ask them about all the other aspects of their health, we need to be asking them about this aspect of their health as well to try and connect them with the services that they need. Sometimes that's mental health treatment. Sometimes that's other services that, like nurse home visitation, that can come in the home and support them in the home. Sometimes that's connecting them with services that are going to help them with their utilities and help them with all the other stressors that they're enduring. But we have to be asking in a more in-depth and caring way within the medical community. And then it's important, as you mentioned, for the educational community to be getting trained in trauma-informed ways of addressing their students, rather than just suspending kids for bad behavior that are young, not trying to understand what they bring, as you mentioned, to the classroom on the first day.
Nancy, there was a picture of a woman who she had a cigarette and she was drinking a glass of wine, and that was sort of her stress reduction.
Absolutely.
And so when I remember seeing that picture, I thought to myself, well, just how much, sort of to your point, people view this as living life. And so I don't have stress. I'm just living life. The one article about the woman who had the one story about the woman who had her electricity turned off,
yes,
and it got turned back on, and then the car got repoed. That's just life to folks. And we may not be saying to them, no, there's something else going on here. You've got stress, you've got trauma. Let us help you. But I remember seeing that picture, thinking, what else can we do to help her? I mean, you talk about the helping with the rent and all those things, but what else?
Charles, I think one of the most important things that I learned from dealing with these moms and talking to them and knowing them over time is they needed to be heard. I mean, one of the reasons they agreed to do this, because they put themselves at risk this way. I mean, they are afraid of the foster care system coming in. I put a lot of scrutinies on these families, but they wanted people to understand their lives were hard, and they knew it. They knew it was hard. It was hard to get a break. That one woman, Darlene, who was liked to wind down with a drink. By the way, she was not pregnant. I just want to point that out.
Yeah, I'm sorry. Yeah, she wasn't pregnant.
One of the ways she got a break from stress, because she had so many children and teens in the house, and a lot of different factors going on in her life, is she would go hide in her closet. And she knew that was actually healthy. So, but actually being heard was so important. So the empathy factor, I mean, if you ask me why I wrote these stories, my number one goal was empathy. I don't know if we got it, but I feel like, we need to start addressing on policy levels where certain segments of our population are and why we're having the outcomes we're having in our society. And the research is so clear on one thing: early childhood, 0 to 3, supports and services have the biggest return on investment out of anything you can do to support a child and an adult. I mean, that's where all your soft skills develop. That's where all the things that can go. So if you give these parents the ability or some supports to be able to raise these children better or be able to attend to them better and escape from that some of that stress, they're going to have better outcomes. And for Darlene, who was dealing with a lot of issues, the game changer for her three youngest children was a home visiting person who was coming and helping her, who got all three enrolled in early childhood. And that was a game changer for those children. Their outcomes, if they stick with early childhood and are in a quality early childhood that's able to deal with stress and other issues that they face, can have a huge impact on them. And I also want to add, too, for these moms and families, when kids do enter the traditional school system, K through 12, that could be very traumatic for parents because they had trauma with school. Schools weren't handling their trauma well. So it's hard to actually communicate with the schools themselves. But where I work at University City now, the whole onus is on humanizing that childhood experience and meeting them where they are. And that includes dealing with trauma, and it includes dealing with training teachers to better be with these students, not directing them so that they don't have these triggers that, cause them to be put out of the educational setting, even in a timeout or in a suspension. So,
which everybody talks about when you have suspensions and you have kids away from school. That's sort of the worst place for them to be, is out of that. Really quickly, I want to bring Risa in a minute. Can the brain be rewired?
So I wouldn't use the phrase rewired necessarily, but the brain is what we call plastic. Like it can change, and experience is what changes our brain. There were studies a long time ago just showing that if you covered a cat's eye when it was a kitten and didn't expose it to light, you didn't change anything about the eyeball, you didn't change anything about the brain. You took that patch off after some time. The cat couldn't see, the cat was blind. And that's because the brain needs experience to develop. Mm-hmm. For certain connections to be made, we need experiences. So experience is really what changes our brain. So for kids who have had traumatic experiences, if you can put them in stable, supportive environments, that can make a huge impact, particularly at younger ages, and how the brain develops. The way that we learn is because the brain changes, right? And we can learn to process information and process our emotions differently if we're in supportive environments. Mm-hmm. On the other hand, if we're put in environments that are not supportive, that involve abuse and toxic stress, the brain is primed to think of the world as a scary place, mm-hmm. and to overreact to what the rest of us see as just very slight, normal stressful things, and so that's why it's important. But everything that we do that involves learning is the brain changing. Psychotherapy is the brain changing, and so it's definitely possible.
And I might add, and Cynthia, you can correct me, but some of the research really points to it doesn't take much in a day to help a child. Just a very solid couple of minutes tuned into a child to take down that stress can do a world of good. Now, I'm not saying it's that simple, but it really is helping a parent be able to ditch it down and be with that child through all that stress.
I saw in my news feed today, mm-hmm. or yesterday, an article about yoga mm-hmm. at a particular school. I think it was in California, mm-hmm. And that's what they would do every day, is mm-hmm. take that moment of silence and reflection, and things like that. But I was curious because of something you said, and something I'm thinking on the whole, I'll say this wrong other end, is the notion of young kids joining gangs to seek what they are missing at home. Mm-hmm. So I know that I'm missing something. I'm not sure what it is, but they're offering something I'm not getting at home. So that's sort of a, I hate to say joining a gang is a positive, but part of that is the search for that sort of comfort, love, support, whatever. Mm-hmm. And that seems to be happening quite a bit. So at least there's a recognition there. There's no service, and we're going to get into that in a second, there's not a lot of services people may feel comfortable with being a part of, where the gang is always recruiting.
the human being we're social animals. We need love and support. We seek the feeling of being a part of some sort of unit, right? Whether it's a family unit, friendship, whatever. When we see kids who, as child psychiatrists, that have made peer relationships that are not positive, what we talk to parents a lot about is how can we help this child get the same thing that they're getting out of these the positives out of the negative peer situation in a more positive peer situation. Sometimes that's, things like, is the child interested in sports at all? Can that be something where they can put their that feeling of being a part of something? And because when you get to adolescence, peer relationships often will seem more important to the child than parent relationships. They aren't necessarily, but that's how it seems. So by adolescence, just saying, oh, spend more time with your parents, that's not going to work. So trying to find other positive peer relationships for teens that are looking for that feeling of connectedness is really important. But you can understand why, if they feel like they're not getting that at home, they don't feel like somebody's looking out for them, they don't feel like somebody's supporting them, that children will inherently look other places.
So the services have to be there sort of immediately, and I would also argue continually, for somebody to believe, okay, these people, whoever they are, care about me enough to where I can trust them. Mm-hmm. I see they support me, those kinds of issues.
Mm-hmm. Charles, I think it's also important, particularly when you get to adolescence, is to empower them that they can create positive change in their communities and in their situation through service projects and other things. I mean, that gives them a sense of power if you can, and that can build community. So, a lot of times when you're in a situation with a lot of toxic stress, you feel powerless. But when you are able to give them some avenues in which they can work to better situations, that is a strong, powerful thing as well. So a lot of schools are really into that aspect of service and doing that to help others. And that seems to be also giving them power and voice, advocacy, things that they didn't have before, that how that feels, the stress of feeling helpless versus the empowerment of feeling like you can make change. So that has, I think, a strong effect on youth.
So you can make change to yourself and
you help
change
others.
To your community.
You can show that you can help others, and that gives you power, and that reduces your stress as well.
Okay. Marisa, how's UMSL?
UMSL's wonderful, but I want to take a step back before you ask a question.
Go ahead.
Because as I'm listening to the conversation, there are a couple of things that really jump out for me.
Mm-hmm.
So a lot of my work has been centered around systems and frameworks and interconnectedness. Mm-hmm. And one of the things that I think would really inform how we approach individuals, families, and communities that are impacted by trauma is understanding that there are social determinants of health, that are things that are outside of your health care that impact and influence your outcomes. And when we start thinking more collectively about what health means and the things that play into health, including your neighborhood, including their access to resources and opportunity, then we start fine-tuning our approach around addressing the things that are harming us. So it's one thing to say, hey, you're experiencing trauma, we need to do something about trauma. But the thing that continues to resonate with me was a conversation that I had with my son. He was maybe 21 at the time. And we were talking about trauma. There was a lot of really good work that was going on in the region specific to young people's experience with trauma. And he said to me, I don't need you to tell me that I'm traumatized because I live it every day. Mm-hmm. So then the question was, so then what do you need? What do we do with that experience of trauma? Mm-hmm. And his response, because he was a young person and they tend to be very succinct and precise, was stop traumatizing me.
Right.
Mm.
Right.
So if we're going to start telling folks that they're traumatized and give them short-term interventions to address the trauma they're experiencing, we have to think about how we're connecting those other social determinants of health and partnering to address the conditions that perpetuate the trauma that they live in on a daily basis.
Thank you, Risa. I actually, one of my interim before I went to UCD schools is I work with Dr. Jason Purnell at For the Sake of All, now called Health Equity Works, and we basically dealt with the social determinants of health. And one of the big findings of their original research was there's actually an 18-year difference in life expectancy between Clayton and the Jeff Vanderloo neighborhoods. So 2 neighborhoods that are less than 5 miles apart. And we cannot dismiss the fact that the conditions of the neighborhoods and the social determinants in those neighborhoods, along with the stress caused by that, is a big contributing factor to that huge gap. And I just can't say it enough. 18 years. I mean,
I don't think it's anything that people are unaware of. And that, I think we all recognize that violence, poverty, lack of access to good food, nutrition, these are all things that are going to impact health, in any community across the world. These are just, the issue is people's desire and motivation to do anything about it. And one of the reasons why I've gone into the work that I've gone into, not just an interest in the brain, is that showing people sometimes, on a individual health and physiological level, what these do, it seems to sometimes be more motivating to lawmakers than just saying, I'm telling you that these kids are having trouble because of, the fact they live in poverty. That's, for some reason, that seems to be really easy for people to ignore. And it's really awful as a society that we can say that. But historically, we can see that that's the truth. But sometimes if you can go and you say, no, look at exactly what this is doing to someone's brain, or look exactly what this is doing to how, our rates of diabetes, and of course for lawmakers, and how much that costs the healthcare system and the government, then sometimes that can motivate people to actually do something for some reason, instead of doing it for the reasons that we all should, from moral and ethical reasons. But I think that it takes how we present this information to the people who have the power to do something about it. And that's one thing I think we all need to recognize, is that we have to be able to move people to action that have the power to do something about it.
Yeah. But I think we also ignore, so everybody said, well, the best way out of poverty is a job. But you're still working that job. But if you are living in mental poverty and no one has that conversation about your mental state, then people work on a job 20, 30 years, but they are still depressed. They're still anxious. They still have these other issues.
This is not a either or situation. Right. So there's what we need to do for prevention, which I think is what Reese is talking about.
Yes.
Then there's what we need to do to intervene with people that are already experiencing symptoms. And those two things have to really happen simultaneously.
Absolutely.
We have to continue to help the people that have already been traumatized and that have, mental health disorders, have other chronic health issues. We still have to have a system that's equipped to help them, to try and identify them. But at the same time, unless we want to be having the same conversation for the next 20, 30, 40 years, we also have to do the larger global prevention work that Reese is talking about.
Now, Reese, I know I want to say continuum of care. I'm not sure that's the right system of care. Thank you. What is the system of care?
Oh, yay! I'm glad you asked. And Mental Health Month, Awareness Month, what a great time to be having this conversation. So the other thing I'm really excited about is that this conversation is more accessible, because before it wasn't something we wanted to talk about, and stigma is a big deal. But we know that we've come to the point where we're beginning to understand, because of things like toxic stress and trauma that people can identify with, that there's no shame in treating your mental health and wellness in the same way that you would your physical health and wellness. So the system of care exists to help folks navigate challenging, stressful mental health situations. It's an opportunity for folks to understand that there is support that's all around them. So if your young person is experiencing any type of mental health crisis, that in itself can throw you off kilter. Navigating the system can be really difficult. But with the system of care, there is a network of providers that are able to walk with you through the process of first identifying what's really going on and what does my young person need, to be able to help those who are in the lives of young people, whether it's in school, whether it's in their pediatrician's office, to understand how to recognize and identify when someone does need help, and to find a way to access what how to get the resources that are required. It's a group, an organized group of providers across child serving systems that looks at birth to 21, 25 because transition is really tough, and finds ways to connect all of those systems we're talking about that seem very disparate so that they can wrap support around young person who are in need of crisis. It gives the parents resources. It also has peer support that's available with other parents who have walked through the process to let folks know that what you're experiencing, you're not alone. This is not the first time. You're not the only one who's experiencing this, and there is help that's available for you. So it's exciting for me to see the progress that they've made, and what we're really excited about is for the first time there's a report that's going to be released next week that captures how prevalent certain mental health concerns are in the region. And so we'll have an opportunity to really, to your point, carry the message to those who are making the decisions to understand that within our region, 18 to 24-year-olds in St. Louis City and County are the ones who are most likely to end up in emergency rooms because of self-harm.
Right.
And that specifically for young women, and the numbers continue to grow.
Which is a cry out.
It is a cry out.
I did want to add that we did the crisis within because we wanted to show and not tell. And the families themselves wanted people to see, not just be told. And the other thing is, I think toxic stress and stress has been a doorway for people that to more openly talk about this. I could have never gone into those neighborhoods with those families and said, hey, tell me about your mental health.
Right.
But the minute I said, tell me about your stress as a mom, the doors opened.
Right.
And let me tell you, the cultural differences were pretty unique. But over time, they knew this was so important, and they did not want this affecting their children.
Absolutely.
What did you mean the cultural differences were unique?
I was a white woman with a white photographer in a primarily poor African-American neighborhood trying to talk to families. And there were boundaries for sure. But I got to say, that question opened the door. And,
did they... Granted, they wanted others to know their situation. Did you feel like you were the lone person there, meaning no one really had asked that question previously?
Yes. Well, I'm going to put this in context of Ferguson, okay? They had been barraged by news, and that in itself was traumatic. Nobody had stuck around to ask, how are you doing? And that was really important to them. Now, they did have some home visiting, and that was helpful, but nobody had really asked them about stress, and nobody had really shown some empathy and really talked back to them and said, that is extremely hard. There is, and I'm making some big assumptions here, but I've been told this, that particularly in the communities I was working in, you don't talk about your hardship. You take it. You shoulder it. And that's hard. I mean, so you don't have a lot of outlets for it. So I think being able to show this and then tie it to the reports and the research is so important. And it did result in some policy in Missouri. There was some work to try to make sure schools had trauma-informed. There's some policy now being put out by DESE guidelines on how to do trauma-informed work in schools, the Department of Elementary and Secondary.
We're going to have Maplewood Richmond Heights on next Thursday, and that's one of the groups. And then I believe Alive and Well has agreed to be on, so we're going to have some of those conversations. Risa, did we leave anything out of the, do you want to talk a little bit more about the report, because Serena said you would, and where does this leave us? I know the big deal is always money on the table for support services, but I also think the conversation around it's okay to go somewhere to seek treatment is a big item in the African American community that we, I'll just deal with it, and so I know that's a problem. But
a couple of things I do want to touch on is the Youth Connection Helpline, because what a valuable resource that is, to be able to have a number that folks can call to be able to be connected with the resources and support. So the system of care has been able to partner with BHR to provide connection and support through the youth.
BHR is?
Behavioral Health Response. Thank you. Very good question. Don't use those acronyms. But to be able to provide a doorway so folks can figure out, you don't have to know exactly what you need or the exact right number to call. If you can get through the doorway, then it is our responsibility on the other end to connect you with the constellation of resources you need to find your path to wellness, right? I think the other thing that for me is really exciting is that we're starting to understand that mental illness doesn't look like what you see on TV, right? That we have all in some way been touched by it, been impacted by it. It can look like a young person who's in a classroom that can't concentrate or is falling asleep or is not ready or willing to engage, because we're talking about how that stress impacts us and how it impacts all of our systems because they're interrelated. So of course, as a social worker, when we talk about person and environment, and we talk about, we're very systems oriented. So for me, it's like, yes, this is all theory to practice. It's all making sense. So again, being Mental Health Awareness Month, that's a great opportunity for us to, in plain language, be able to demonstrate how this touches all of us, and that there are resources that are available, that the community is rallying to be able to provide the support that's needed. There are some, again, partnerships that have existed as a result of the work through the Mental Health Board and System of Care that are revolutionary in our region. So the St. Louis City Department of Health and the St. Louis County Department of Public Health working together to collect this data and these resources that are partnering with us to release and produce the reports where we can actually measure and so show progress towards improving how we're doing, improving the outcomes, the psychosocial outcomes of young people in our region. And so this is a beginning. Right? There's more greenfield, there's more opportunity, there's more willingness, there's more desire for us to partner together to understand how we address what we're finding out to be so true. And particularly if we look at the fetal mortality and maternal mortality rate in St. Louis, we have a lot of work to do, but we have a lot of strong foundation for us to partner together to make sure that we have a thriving community.
But at the end of the day, if I'm not willing to accept what's going on with me, then isn't that the difficult part? And how do you really? I was trained 30 plus years ago by parents as teachers, which I still think is one of the most incredible. But I was told then, parents as teachers is having difficulty getting in North St. Louis.
Still true. And you've hit a really important topic that sometimes we have to figure out a way to make acceptance of mental health disorders and treatment more universally accepted in the African American community. And I think we've made some strides, but we still face situations where we are willing, ready, able to help people, and they are still very guarded and still not at a point where they want to accept that they have any sort of mental health problem, or they have family members who are telling them, you're fine, don't listen to them, you don't need treatment. We've had pastors who have told people, you just need to pray, you don't need help. You wouldn't say that to somebody who had diabetes or had a heart attack.
Right.
And so it's really on us to continue, shows like this I think are important, really working with the schools and the school systems to really think about this as a curricular component, that kids need to, just like in health class they learn about everything else, this needs to be thought of because it is a health issue. The brain is just another part of the body, and it can get sick and have dysfunction just like every other organ in your body. And we need to help people to understand that so they're more willing to accept the wonderful things that are happening with systems of care, the way that we can connect people, the treatment providers that are able and willing to provide treatment. But I'd like to see the city of St. Louis do a massive education campaign around mental health in ways that are accessible to the people we're trying to reach. Have the radio stations participate. Like that's the kind of things, it's helpful that a lot of different, hip hop stars and celebrities are coming out and talking about their mental health issues. Sometimes it's easier to hear that than to have some doctor like me come and tell you this is what's going on. But it needs to be a concerted effort because I feel like stigma is still this hurdle that remains that we have not tackled in a fully pronged way, particularly for the African American community. We really need to make
Yeah.
we need to throw everything at it.
Well, that and self-medication is also
Right,
Well,
and that's part of
yeah.
it, because I don't want to admit I have a mental health problem, so I'm just going to smoke as much marijuana as I need to get through the day.
The challenge is really also having grassroots movements being able to get to the surface with some of these system power brokers.
Right.
So one of my favorite organizations that really bubbled up after Ferguson is JAMA Birth Village,
Yeah.
because they work with African American expectant moms, and they do all sorts of fantastic, culturally sensitive work with them, and that's just spreading out into the community. But they need to be in the power broker system as well.
Right.
They're getting there.
Yeah.
But
And-
yeah, go ahead. Yeah.
One of the things that I'm seeing and that I am very biased towards is efforts that engage the folks who are experiencing the issue, right? So more of that peer support needs to happen. It is much better received, not from me, but from somebody who's walking the walk, right?
Exactly.
Someone who's experiencing what I'm experiencing. So, for example, System of Care has families, they have a group of people with lived experience. So family members who get together to talk about this is what we know because this is what we live, and what supports do we need. So efforts that are engaging community ambassadors or community leaders, whatever you want to call them, whether it's through Recast, whether it's through Alive and Well, I'm going to hear from folks who are respected leaders in the community who look like me and who share some of my lived experience. I think one of the things that we have gotten wrong in the past is that we have come at it from an academic perspective to try to say this is a problem and here's why you should care, without first going and saying, here, look, I care and I'm invested, I'm engaged, and what do you need, and how can I partner with you to develop what you need? And I think we're starting to understand that more, and understanding that there is so much expertise in the community that can inform how we partner in order to get the right information in the right way to the right people with the right voices carrying the message. Then another thing I want to go back to, Dr. Ryder, something that you said was about showing the brain. I know for my young person, what he said to me was what changed the paradigm for him was seeing pictures. He was like, well, now that makes sense to me. If you show me the brain and you can show me like neurological pathways are disrupted and synapses are not, he's like, so now, all right, that's kind of cool. And I kind of want a brain scan myself, right? So are there ways? And so the way we communicate to different audiences needs to change as well, because we assume that people aren't going to want to hear that or care about that information. But that's not necessarily true.
Now, there's a big debate about the ACEs survey, and you can chime in on this, because a lot of, particularly in poor communities, they don't know about the ACEs. They don't know the information. And the question is, do you have somebody take an ACEs test and talk to them about it without with other factors? But when I wrote that report, and we talked about ACEs quite a bit, the most emails I got back were from African American women wanting to do that study. So, I felt like the barrier was people were afraid to give people this information, but at the same time, the people most affected by it wanted that information. So, I you know what I'm saying?
Give people choice.
Give people choices, right? Who's in control? Who's in control here?
We'll also give them give people the option and the opportunity. I remember years ago they had the big issue around smoking, and so what they do, they showed healthy lungs and not healthy lungs, like everywhere. And you couldn't go anywhere without seeing that dramatic picture. And now recently I think they've started again, and they're showing people who've their parent or their kids, and how using cigarettes has harmed the family in total. And so there are ways to have that type of campaign so that everybody understands. I saw in the article the I'll say synapses, because I don't know what they are, but how they are shortened, and what does that look like. And so you've built your brain, or your brain has been built around something different than love and empathy, etc. It's built hardwired to fight or flight, and in today's society, you're going to fight, you're not going to flee. We only have a couple of minutes left, I believe, and so I want to kind of wrap up sort of backwards. Risa, what things do people need to know today to help us move this conversation forward?
Ooh, that's wonderful. I think the most important thing to understand is that there is no health without mental health. And so the same way we think about how we need to take care of our bodies, we need to include our brain in that equation because it is arguably the most important part of our health and well-being. The other thing that I think it's important to remember is that there is support that's available. So if you feel like, I don't know what's going on, but I think I might need some help, and you're not entirely sure, I encourage you to reach out and just find that one doorway and allow us the opportunity to wrap support around you so that you can get the interventions, the services, or whatever it may be along the spectrum that you need.
Dr. Rogers, and I would be remiss if I didn't say congratulations on your upcoming award.
Oh, it was last Friday, but thank you.
Oh, I was trying to be nice.
Yeah. Thank you. Thank you.
What do we need to do to move this forward? You've said that a little bit, but if you want to reiterate.
Yeah, I mean, I think it's really multi-pronged, but education around that mental health is just, part of your body having dysfunction like other parts of your body. Making it okay to seek help, I think is really another important part of education. Continuing to educate the public about what these stressors do to the brain, to children, to our society, and educating lawmakers that if you really want to make a dent in all the outcomes that you say you do, then you have to invest in the communities, you have to invest in the healthcare system so that we can provide the services that we need. So it's really multi-pronged education.
Thank you. Nancy, thank you for the articles.
Thank you.
I read them 4 times now, and you can see all my page notes. You've done great work, but what's next? What do we need to do as a community, as a society?
Well, one, we need to invest in early childhood. It's just a no-brainer. The research is just so clear on this. 2, we need to be building better systems. We can invest, but if we don't have the systems that really wrap around people, it's not going to work. I'm pretty excited at some of the things that are going on in St. Louis. First off, the equity conversation is a big deal, and particularly when we talk about our segregation in St. Louis and kind of breaking some of those barriers down for opportunity, that's going to reduce stress significantly. There's a lot of work that was done through For the Sake of All / Health Equity Works regarding school-based health, early child development accounts, housing, particularly because we've decided that segregation is a social determinant of health. So these conversations need to keep happening, and one of the ways this really happens is these grassroots groups working with other sectors in the community to build these systems. It's very exciting that the hospital systems and the federally qualified health centers started working together, and also working with other groups. It's very exciting that Alive and Well Communities is in the schools and building a whole network of trauma-informed schools and collaboratives to talk about it, and also building student ambassadors. So these are systems. They're not just programs put in. I mean, programs are great, but if they're not coordinated and they're not working together, and one zip code has it and the other one doesn't, it takes a lot of work, but the conversations are happening in St. Louis. It would be nice to have the money, but we're going to have to probably do it locally for a while with our legislature and our federal. But these are really critical.
Thank you all. Appreciate the conversation. We're going to do this for the rest of the month. So hopefully at the end of the day, we will have some not only solutions, but ways to move forward. I want to thank you all for being with us today.